Indian Gerontological Association Jaipur, with the Association of the National Initiative for the Care of the Elderly and the International Collaboration for the Elderly, University of Toronto, Canada, organized a 5-day national workshop on geriatric nursing care at State Institute of Health and Family Welfare, Jaipur from 14th November to 18th November 2007. On 14th November, the Chief Guest of the inaugural function, Professor R.S. Bhatnagar, President of the Indian Gerontological Association, lights the lamp and inaugurates the workshop. At this occasion, he said, "Each of us has a body. It is body which puts us in touch with the world. It is through body that we experience, enjoy and act. However, there is a self or mind which is housed in this body. Therefore, when nurses take care of body of the patient, an elderly patient, they also encounter the mind or self of the patient. Most old people who in their indisposed condition have hardened attitudes become perturbed by small and trivial things. It is difficult to tend them. They need a sympathetic understanding. Nurses have really a difficult task when they take care of them. These elderly patients demand psychic care. Some sort of empathy can go a long way in trying to help them. This is really a taxing job, but with their usual patience." Dr. Sandra Hirst, Associate Professor in the Faculty of Nursing at the University of Calgary and Director of the workshop, introduced the theme of the workshop.
It's a tiny little church that if you didn't know you were walking down the path, you would never know the miracle that this lady created for our nursing profession. She shaped who we are. She talked about education. She talked about learning. She talked about caring. She talked about opening windows to get fresh air in. She changed who we are as a nursing profession. So for me, that was a very powerful moment. Thank you, and I would treasure that. The third point I wanted to mention just briefly was that I have both a privilege and a responsibility. I have been a nurse now for 35 years. A very kind gentleman last night said to me, "You don't look as old as you are." But I have practiced for 35 years, most of that time with older adults. And it was a choice I made. I made that choice when I was offered a job of working at a children's hospital.
Founder Secretary of IGA, Dr. K.L. Sharma, told that the aims of the workshop are provide improved ideas and practices in the care of elderly, refine existing practitioner skills in the care of elderly, draw attention of general practitioner to the needs of care for elder adults, positively influence government policy initiatives on geriatric care. Earlier, Dr. Vimal Agarwal, coordinator of the workshop, highlighted the activity of Indian Gerontological Association.
Indian Journal of Gerontology, which was the first journal of its kind in India and 19th in the world, was published in the year 1969. It publishes research and review papers on aging from biological, clinical and social sciences. Now, the journal is online. Apart from conducting researches and publication of journal, in short we call this as IGA, Indian Gerontological Association, runs a daycare center for elderly belonging to unorganized sector of society and counseling center, that is Rahat, for elderly. Under this program, Aging Gracefully, Extending Quality of Life, which emphasizes positive aspect of aging. we organize lectures on different diseases which are common in old age and self-care practices and training to care providers at the family.
Later, the first day was mostly spent discussing the question, what is normal aging and normal aging changes.
Stomach and system. What happens as you know when we age? What happens to your teeth? Loss of teeth? Atrophy? There was a really interesting article that was really again, I know a lot of reading to come here. I wish I could read English, but there was an article on oral health care in this country in older adults. And it was talking about the establishment of programs of dental care in your country to work with older adults. And what? Yes. So a number of issues. Loss of teeth, atrophy. We know there are changes in perception of taste.
On the second day of the workshop, Dr. Senti pointed out that it has been found helpful for students of geriatric nursing to first work with healthy seniors so that they understand the high level of activity that can be expected of elders while still recognizing their special needs. In terms of teaching students, the instructor's attitude has been identified as one of the most significant factors in achieving positive results. As teachers, we must lead by example, showing students how to interact respectfully with patients and how to be sensitive to their body language. Through our various teaching methods, we must ensure that students become confident in what they are doing, which means they know the reasons behind their actions.
कब रिलीज करना है, कब इसको चेंज करना है, कौन कैसे करना है, तो इसकी बेनिफिट है ना जो आजकल की जो प्रैक्टिस है आप लोगों को मालूम है क्या करते हैं, टेक केयर ऑफ दी आफ्टर डिस्चार्ज पेशेंट्स का प्रॉब्लम को.
Our students in my courses in my students.
She also said that using all our senses to perform continued and varying assessments will lead to a more holistic understanding of the patient and their needs.
And she or he may visit the older person every day to help them do their dressing. They may help them to get up or to move. But that nurses work in the hospital or they work in the home.
Dr. Hirst discussed common chronic problems on the third day of workshop. These include incontinence and elimination, diabetes mellitus, strokes, dementia, depression, coronary disease, and common behavioral problems.
They don't see me actually doing what I believe is important.
Professor Uday Jain, former Vice Chancellor, APS University, Rewa, Madhya Pradesh, introducing Dr. Uday Parikh, former Professor of Psychology, IIM Ahmedabad. Professor Parikh shared some of his extensive knowledge in the area of positive psychology and how it relates to care of the elderly. Third day, Dr. Gurbir Singh, Medical Director, Fortis Escort Hospital, Jaipur, spoke on gait, balance and falls, and Dr. Namita Bhagat talked on osteoporosis. Fourth day starts with the theme, caring for older adults and their family. Dr. Sandy discussed about the families and aging, abuse of elder adults, family care, giving and use of tools. She discussed theories of nursing and why we age at all.
No feel that loneliness, no loneliness. So social company, share happiness. All right, come on. We're walking down this way. What emotions would I hear here about successful aging? You're 65. What emotion do you want to feel?
On the same day, Dr. L.K. Kothari, former professor of physiology, SMS Medical College, speaks on age-related body system changes. He emphasized the physiological changes in the elderly and how the concerned person feels about it.
What bodily changes occur with aging? As you grow old, what changes occur in the body function? So, our arteries with age get hardened. उसको क्या कहते हैं जो चेंज होता है आर्टरीज में होता है डिजीज arteriosclerosis or atherosclerosis. There is some slight difference, but atherosclerosis is a very, very common thing that occurs with aging. It is so common that we can't say whether it's a disease or whether it's a part of aging. But atherosclerosis is detectable after you're 60. The arteries are getting hardened and so the blood supply is getting diminished to various organs.
In the morning session of 5th day, Dr. Sandy discussed on elderly and HIV/AIDS. She added that geriatric nursing is a challenge as older people are sexually active and they can be gay and lesbian, bisexual or heterosexual. Dr. Vimal Agarwal spoke on cancer and tips for living happily with cancer in old age.
When you reach an elderly person who is suffering, they do not come out with a lot of, if you go to take history from those patients, they are not going to talk to you much. We have to use some other technique to get information and from the family because they have nothing more to talk to you because their mind is full of these type of critical thinking. Then their possessions, their family ties, what they are going to lose, they are thinking. And you are going to take some other message. And everything put in a nutshell is that their mind was very unresting. You may give them drugs, you may talk very pleasantly, you may smile at them, thinking that they may smile with you, but they do not easily smile with us because they understand what goes on in them.
Professor P.P.S. Mathur, Vice Chancellor of Rajasthan University of Health Sciences, was the chief guest of the valedictory function. Dr. Mathur appreciated the content of the workshop. He also emphasized the need of such workshops in future since the number of elderly patients is increasing in hospitals. He said that the trained geriatric nurses are the need of time not only in Rajasthan but throughout India. Dr. P.P.S. Mathur distributed the certificates to the participants. Some participants expressed their views about the workshop. Mr. S.K. Bissa, participant from Jaipur, thanks to the foresightedness of Dr. K.L. Sharma, due to which we have been able to take an initiative towards geriatric nursing. The workshop was organized well and the discussions on different aspects of geriatric nursing were useful and interesting.